Hello, Doc.
Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
Hello, Doc. How you doing?
Fine,
It's been a while. Today I wanted to sit in, right, because we're talking testicular cancer, and I figured I could get one or two information for myself, right? So why not sit in myself and speak to you? How you doing, though?
Oh, very good. By God's grace.
Yeah. We thank God. So first things first, as usual, what is cancer scares me. I don't know. Cancer should scare everybody because when we hear cancer, we know that usually doesn't have a cure, and my readings tell me that you guys don't even know what causes the cancer and all that, but let's see how it goes. What is testicular cancer?
Yes, so as usual, we know what cancer is. There's the uncontrolled multiplying of these abnormal cells, and depending on which part of the body, then that's the cancer we name it after. So testicular cancer has to do with the testes.
Okay.
Yes, so the main issue is that it's not really the most common cancer in men. We have prostate cancer, liver cancer, and all that. But the issue with it is that it's very common in the younger ages. So between the ages of 15 to 35 years.
Wow.
That's why we see a lot of these testicular cancer cases.
Okay.
And
Is it a recent development, or that's been the order?
well, for the past few, let's say 20 years or so, that's how the picture has been.
Okay.
Yeah. And it's important because it's I think it's during the puberty age. So when there is more of the activity of the, should I say, hormones and all that. Yes. So it's very important for men to also take note of that, and they tend to progress very fast, especially in the young people. It progresses very fast among them and can lead to infertility.
Okay.
Yes, but it's highly treatable. It's actually one of the cancers that has like a 95% rate of being treatable. Like that's once you notice it
Okay.
early enough before it has spread to the other organs, you can treat it very within a short time. Yeah.
Let me try to get a myth out of the way, right? Is this I don't know why doctor is smiling. She doesn't even know what I'm going to say, but is this type of cancer in any way related to sexual activity, as in whether you having more of it or less of it, and it has some correlation with testicular cancer?
Yes, that's why I'm smiling. That's usually the question that people ask. But no, it's not associated with the frequency of sexual activity. It's not associated with bicycle riding, because I think it was one of those
that
cyclists
too.
who had the testicular cancer. It's not associated with bicycle riding. It's not associated with tight clothing. It's not associated with vasectomies.
Okay.
Yes, so let's get that out of the way.
I like that. Now let's look at the types of testicular cancers.
Okay, yes. So with the testicular cancer, we have what we call germ cell tumors and non-germ cells. So germ cells are just the reproductive cells of the body.
Okay.
So the germ cell tumors are actually what is 95% most causes of the testicular cancer.
Okay.
So the germ cells, that's the sperms. The sperm cells actually. So depending on the stage, the different stages of the sperm cells and all that. So the germ cell, we have two types. We have the seminomes and then the non-seminomes. Seminomes are usually what happens in the older people, 30s to 40s, and those ones are typically slower.
Okay.
But then the non-seminomes, those are what are occurring in the teenage years to early 30s, and those ones progress very quickly.
Okay.
Yeah.
Okay.
And then the non-germ cell is those supporting cells around the Leydig cells that produce hormones and other supporting cells around lymphomas that can be in the testicular region, but usually the commonest ones are the germ cells.
Okay.
tumors.
Okay.
Yeah.
We got a myth out of the way, but do we know what actually causes testicular cancer?
No, as in most cancers, we don't really know, but we have what we call the risk factors. So the things that if you have them, you are at a higher chance of developing the testicular cancer. But that doesn't mean if you don't have risk factors, you can't get it. You can.
Okay.
Yes. So we can talk about the risk factors. Is if you have a family history or a personal history. So if you had testicular cancer in one testicle, the chance of getting it in the other testicle is higher.
Very high.
Or if you have a close family relative, like a direct family, father, mother, brother, sister, then not mother, sorry. That's why it's only men. So either your father or your sibling. Then if you have a history of undescended testes. So you were born with undescended testes, and
Yeah.
it had to be surgically brought down. Or sometimes if you had inguinal hernia, where the testis was trapped somewhere, or something came into the scrotum whilst you were a child, early childhood, that could also be a risk factor.
Okay.
And if you are already someone who was already having infertility issues, that could also be a factor. And usually the risk factors, we are saying it's common in blacks, but this one is actually more common in Caucasians.
Okay.
It's more in white people.
Okay.
Yes, than blacks. So we are probably like maybe 10% of the total prevalence in the world.
Okay. Any signs to look out for, signs and symptoms of testicular cancer?
Yes, very important. So when you see maybe there's a swelling in the scrotal area, or sudden fluid build up in the scrotal area, or you feel there's a lump around the testicle area, or you feel heaviness in the testis, or there's pain or like a dull ache either in the testis or in the lower abdominal area, like area surrounding there. Yes, that's a sign. And sometimes to shrinkage, sometimes you realize that it's shrinking much smaller than it used to be. And sometimes
but that one to the cold weather too. Sometimes when we're in cold weather, it can shrink apart and then you can't find it.
I don't know about that.
I'm telling you from experience. That's in extreme cold weather. It's like, hey, where is this thing now? It's missing.
Yeah, so not that it would just be like one time, but you see it persisting. Yeah, and then also maybe the consistency, or when you feel it, it feels very hard.
Okay.
It's not supposed to feel very hard, but if it feels very hard, then probably you should you should take notice. Can I just talk briefly about how to examine?
Yeah. No, I was actually going to ask you because my mind went to breast cancer and how ladies are taking through examining and all that. I've never heard anything about testicular cancer and how to examine it.
Let me tell you how to do that. So you do it at least once a month. When you're doing it, make sure you've bathed with warm water. That will relax the skin in that area. So the first thing, make sure your hands are clean. You can do it standing up or lying down. Okay, then you can use both hands. If that is your first time, it's better to use both hands. So use one hand to hold the testis in place and another hand to use your thumb and the other fingers to try and then feel around it. So normal, it should feel like oval shaped, egg shaped, like with some cords at the top side. So normally it should be smooth all around.
Okay.
Yeah, so you should just use your hands to just feel around it, and then
the testis itself should be smooth all around,
yes,
or the sac, the scrotal sac.
Not the scrotal sac.
Okay.
The testis in the scrotal sac.
Okay.
Should be smooth all around.
Okay.
Yes.
Okay.
So it shouldn't be too hard. It should be smooth and firm, but not too hard. And normally one is bigger than the other. It's a normal variation. One is slightly bigger than the other. But if one is like 2 times the size of the other, then it's a problem. Yes. So you should just do that, and then you look out for any lumps around anywhere, or you feel a change. So if you do it regularly, at least once a month, and you notice that there's a change, this one feels like it's getting heavier and those kind of things, then you can notice those things. So it's not really a complicated thing.
But this one too, can we have our partners check it for us?
Ideally, it's best if you do it yourself so that you can know.
But we've been checking the breast for you. You have to check it for us. Sometimes we don't know how to check it ourselves. Feel it for us, and then anyway, we'll see how we go about that. But walk us through the stages of testicular cancer.
All right. So we have the stage 1, 2, and 3. So stage 1 is when the cancer is confined to the testicle itself.
Okay.
So you might just feel a lump around there, or you feel swelling or whatever. But once they stage it, they would be able to identify that it's only in the testicle. It hasn't moved outside there. Okay. Stage 2 is when it has spread to the lymph nodes and to the lower abdomen or to the back. And then stage 3 is when it has gone to other organs in the body. Okay. So usually we do the staging so that we know like how to treat. We make decisions about treatment. So you are not going to stage it yourself. We would have to do some diagnosis, do CT scans, lab tests, and other things before we can stage it. Yeah.
Okay. So you said earlier on that if it's early onset or early stage, then there's a very high chance of being able to treat it completely, right?
Yes.
Okay.
You can cure it completely.
Okay. Now let's look at the recommended treatment options then.
Okay. So like most cancers, it's either we do a surgery or chemotherapy, radiotherapy. But with testicular cancer, the way it is, for all cases, we would have to remove the offending testicle.
Wow.
Surgically remove it. Yeah, we can't remove just a lump because the organ itself is small.
Small, yeah.
Yes, so we can't just remove a lump from it. So we have to remove it. So if it's your right testicle that you found it, and then we do the test and we find out that it is actually cancer, then we have to remove it. So just because you find a lump doesn't mean we are removing it, but we would have to do some tests, and then we would have to do what we call a biopsy, usually a needle that we just use to extract some of the cells from it, and then they would look at it under a microscope and then see if it's characteristic of cancer cells. If it is, they would have to remove that testicle so that it doesn't spread.
Okay.
Then after that, then we would do the chemotherapy and then the radiotherapy. Some of the chemotherapy, if it's especially early stage, sometimes it's just a single dose, like treatments and all that. It's not as dramatic as some of the other cancer treatments.
Okay.
Yeah. So once you find it early, it's not really so, should I say, dreadful a treatment to go through.
Yeah. What is the effect though if you have the testes being removed as part of the treatment? What is the effect on the individual, especially with reproduction?
Well, if you have one testis left, it shouldn't really affect much. Yes.
Okay.
So it's.
So you would want to catch it early, so that at least
it doesn't spread to the other testicle.
Okay. I'll ask you a final question, especially with cancers, because you even mentioned the risk factors that if you've gotten testicular cancer before, you actually stand risk of getting it again. So what are the chances of recurrence even after treatment?
Okay, so after treatment, if you found it early, in the early stage 1, 15 to 20% chance it can recur.
Okay.
Yes, but if you found it stage 2, stage 3, then the chances
reduces.
No, to recur. So the chances go up.
Okay, actually higher.
Yes.
Okay.
Yes.
Okay. So if you catch it early, there's a lower chance that it would recur. But if it's late, then the chances are higher.
Yes.
Okay.
Yes. But generally, it's not that common in the first place, and it doesn't recur as much as high as with something like breast cancer.
Okay.
Yes. So the numbers are in your favor.
Thank God for that. Any other thing you want to add it before we wrap up?
Yes. So usually a lot of men dismiss these symptoms. They'll see a lump in their testicles and all those things, and then they are embarrassed or they are afraid that they will lose their testicles, so they don't want to come. And then
I'm not embarrassed by it too.
that waiting is
Yeah.
actually making things worse. So the earlier you come and seek treatment, the better. Most of the lumps that people find are not actually cancer.
Okay.
But I can't tell you which one is cancer, which one is not cancer, just by the feel of it. You have to come to hospital for a professional to actually assess it and then do proper examination and then maybe do some scans to be sure. Yes, so to be
When
on
we
the
come
safe
to the
side,
hospital, is it a male professional who will do that? Or the females too? Because sometimes I know guys, like you mentioned, we don't want to come and then some female is,
Well, if you meet a female doctor, you can just tell them that you prefer you prefer to talk to a male professional, and they would let you do that.
Okay.
Usually, if I am seeing someone with such a condition, even we have to get a chaperone, maybe a male nurse or another male colleague to come in to stand in before we do the examination. So you don't have to be so
shy about it. Yeah.
So just come. Let's do the testing and then let's make sure everything is okay.
Okay. All right. My mind is at ease now. Before we started, there were a lot of things going through my mind, but It's not as scary as I thought it was.
Oh, not so much, but it's important.
Yeah, it's important. It's important. So, I've never actually. I need to confess, I've never examined my testes. I've never done that, but I need to do that.
You need to do it at least once a month.
At least once a month.
All your listeners, everyone, all the males, let's all try and be doing that.
By me, I'll get my partner to help me as well. Yeah.
Just as well.
Thank you very much, Doc, for coming on the show this Wednesday afternoon. That was Dr. Emefa Dzide, Senior Medical Officer at Wejagbawe Municipal Hospital. Joins us every Wednesday for Hello Doc. Today we took a look at testicular cancer. Thank you once again, Doc, and have a great day.